It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you how to stop being intimidated by the intensive care team and how you will be seen as equals. You can check out last week's blog if you're clicking on the link below this video. In this week's blog, I want to show you why decision making in intensive care goes way beyond your critically ill loved one's diagnosis and prognosis. If your loved one has been admitted to intensive care for critical illness, chances are that you and your family are out of your comfort zone. You feel frustrated, vulnerable, frightened, scared, without peace of mind, without power, without control, and without influence. Furthermore, you and your family have really no idea what's happening to your critically ill loved one. All you can see is tubes, monitors, and other technical equipment that's keeping your critically ill loved one stable and or alive. If your loved one is critically ill in intensive care, is relatively stable, and is on their way out of intensive care, you don't have to worry too much, as the next steps are on the horizon, and that's great news. However, if your critically ill loved one is not on their way out of intensive care, and if they are in a dire and critical situation, such as they are very unstable and in a very critical condition, or if they are in a life-threatening situation, or if they are in intensive care for long-term treatments and long-term stays, or if they are even approaching the end of life in intensive care, you and your family are in a situation that's testing your patience, your strength, your belief system, your values, and it will also be a test for your communication skills with the intensive care team. Your worst nightmares have become a reality, and you and your family are at a loss and you don't know what to do. Now, the reality and the fact of the matter is that if your critically ill loved one is in one of the situations that I described before, peace of mind, control, power, and influence are generally speaking out of your reach. That's of course only if you are like 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power, and no influence. And they also consciously or unconsciously believe that they can't have peace of mind, control, power, and influence in those difficult and challenging situations. But if you consciously decide that you want to belong into that tiny little 1% bracket of families of critically ill patients in intensive care who have peace of mind, control, power, and influence, and that it's totally within your reach if you only learned the right skills, the right strategies, and if you only learned what's happening behind the scenes in intensive care. The reality is that if your critically ill loved one in intensive care falls into one of the categories where they are very unstable and in a very critical condition, or if they are in a life-threatening situation, or if they are in intensive care for long-term treatments and long-term stays, or if they are even approaching the end of life in intensive care. The fact of the matter is that in those situations, the intensive care team wants to call the shots, and they want to keep all the power, control, and influence to themselves. They have no interest in putting any decision-making power over to you and to your family. Why do I say this? I say this because after more than 15 years intensive care nursing in 3 different countries, I have seen many situations where the decision-making process around your critically ill loved one's diagnosis and prognosis by the intensive care team goes way beyond the clinical issues at hand. What do I mean by that? You see, if your loved one is in one of those critical and or life-threatening situations, there is a lot at stake. After all, it's your critically ill loved one's life, their health, and after all, it's you and your family who need to live with the consequences of the situation. However, the intensive care team often bases their decision-making in those difficult situations around what's happening behind the scenes in a busy, stressful, and competitive environment. Let's say your critically ill loved one has been in intensive care for 4 weeks after a car accident with a head injury. Your loved one still hasn't fully woken up and they are still on a ventilator with a tracheostomy. The recovery of your loved one has been extremely slow and the intensive care team has been very vague about the future of your critically ill loved one. You can see that your loved one is having a difficult and hard time, and so do you and your family, because you basically are putting your life on hold whilst your loved one is critically ill in intensive care. You haven't slept properly, you haven't eaten properly, you have neglected the rest of your family, you haven't been able to work, and the list goes on. In fact, you are close to a nervous breakdown as it's all getting too much for you and for your family. Worst of all, as time progresses and your loved one is still not progressing, the intensive care team wants to meet with you and your family to quote-unquote discuss the next steps for your critically ill loved one. In the meeting, the intensive care team says that after 4 weeks, your critically ill loved one has not progressed as well as they would have liked them to progress, and they are wondering whether continuing treatment would be quote-unquote in the best interest of your critically ill loved one. For the first time, you and your family are hearing the words withdrawal of treatment and limitation of treatment. You and your family are very surprised, if not shocked, by what the intensive care team has been telling you. Even though your critically ill loved one hasn't been progressing as quickly as you would like them to progress, you and your family were prepared to wait, to be patient, and basically to do whatever it takes in order to get your critically ill loved one through this challenge. What you and your family don't know is that decision making in intensive care is going way beyond your critically ill loved one's prognosis and diagnosis. What do I mean by that? The situation that your critically ill loved one is in is a difficult and challenging situation. It's a resource-intensive situation. Furthermore, the intensive care team knows that your loved one would need more time to recover and would use more of those expensive and precious resources in an already stretched intensive care unit. Furthermore, the intensive care team also knows that if treatment is being continued, they would lose money and they would lose their profits that they've made so far. Furthermore, the intensive care team also knows that other admissions are waiting for precious and scarce intensive care beds. If they don't admit other acute admissions into the unit, they might alienate some other powerful key players such as surgeons or emergency room physicians, etc. The intensive care team also knows that the interest in continuing treatment on your critically ill loved one not only stops them from making money, they also lost interest because your critically ill loved one doesn't fall into a medical research category, whilst other patients in the intensive care unit fall into a medical research category. You might wonder, why is this important? It's important because medical research tends to attract annual 5, 6 or even 7-figure funding, and intensive care units rely on getting funding for medical research, and if your loved one doesn't fall into one of those medical research categories, the intensive care team might have an interest in moving on to the next case, where they can practice research and therefore attract more funding. The same applies that if your critically ill loved one is actually in a situation where they are approaching their end of life, the intensive care team may actually distort the facts once again, and they may tell you that a recovery is possible, whereas in fact a recovery may not be possible. However, because your critically ill loved one may fall into a medical research category that attracts 5, 6 or even 7-figure dollar funding, and the data the intensive care team can extract from your loved one's treatment might be of interest for one of the research studies being conducted in an intensive care unit. In those situations, your loved one is going through prolonged and unnecessary suffering. Therefore, once again, decision making in intensive care goes way beyond your critically ill loved one's diagnosis and prognosis. You and your family's job is to have and develop an acute awareness about what's happening behind the scenes in intensive care, and you and your family need to have your own positioning worked out in those difficult and challenging situations. How do you do that? And how can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free reports, you'll also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. You learn how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get plenty of real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll also get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.